On behalf of Mental Health Foundation Australia, I begin by acknowledging the traditional custodians of the land on which our offices stand, and we pay our respects to their elders, past, present, and emerging. We acknowledge the sorrow of the stolen generations and the impacts of colonization on Aboriginal and Torres Strait Islander peoples. We also recognize the resilience, strength, and pride of the Aboriginal and Torres Strait Islander communities. On behalf of the Mental Health Foundation Australia and our CEO, Mr. Vasan Srinivasan, I would like to welcome and thank each one of you for attending today's Be Well educational webinar on psychological therapies for people recovering from psychosis. Today's webinar is specially organized as part of Schizophrenia Awareness Week, held this week from Sunday, 22nd of May to Saturday, 28th of May. The theme for this year is Connecting with Hope. And the key messages for this year are connecting with hope, sensitively considering some people may be feeling helpless and hopeless. The busting myths are that we need to reduce fear and enhance awareness of schizophrenia. Also, recovery is possible. And finally, being inclusive of family and carers is important. Now, it's my great pleasure to introduce our presenter, Dr. Eric Morris, who will be presenting today's webinar on psychological therapies for people recovering from psychosis. Dr. Morris is a senior lecturer in clinical psychology in the School of Psychology and Public Health at Trobe University. He is a clinical psychologist and researcher based in Melbourne, specializing in psychological interventions for psychosis. His clinical experiences in providing cognitive behavioral and family interventions for people recovering from serious mental illnesses, such as psychosis and bipolar disorder, and their families. He has been practicing acceptance and commitment therapy for over 20 years, including supervising and training therapists using contextual cognitive behavioral therapies. He also researched acceptance and commitment therapy as a group-based intervention for people recovering from psychosis and as a workplace resilience training for mental health workers. Please join me in welcoming Dr. Eric Morris.
Thank you so much for inviting me to speak today, and particularly this week in being able to share about psychological therapies for psychosis, and to be able to reach this audience here and to share some of the work that we're doing. So I'm going to attempt to share my screen. Let's see, hopefully you can see the slides there. And yes, I work these days at Trobe University as a senior lecturer, and also at Northwestern Mental Health in Melbourne as a consultant clinical psychologist, focusing on service development and research around psychological therapies for psychosis. And I thought I would take the opportunity today to share in particular about the model that we've been researching at Northwestern Mental Health and at La Trobe University called acceptance and commitment therapy. And what I'm going to try and do is give you a sense of how this particular type of cognitive behavioral therapy might go some way to meeting the needs of people with psychosis, and to give you a sense of how in practice we offer acceptance and commitment therapy and work in collaboration with consumers recovering from psychosis. So yeah, I'll try and give that flavor today. And I think what's important first is to go back to really seeking to understand what is it that people diagnosed with schizophrenia want as treatment targets, as the kind of help that they would seek from services. So one lens that I'm going to take today is to talk about psychological therapies as offered in public mental health services. That's the area I'm most familiar with. But you can think about psychological therapies offered in all sorts of environments. And what's important about psychological therapies is that we are offering approaches that are likely to meet the needs of people seeking help. And when we go back to the fundamentals of actually asking people with psychosis what they want to focus on, then we see, and this is from a study by Daniel Freeman and colleagues in the United Kingdom a few years ago, that people with schizophrenia typically want things like they want to feel happier, they want to worry less, they want to feel more confident in themselves, to be able to do more things that matter in their lives, to be able to feel more confident about the decisions they make, to feel safer where they are, to be able to sleep better. And if they hear voices, to be able to cope better with hearing voices, and maybe to have different relationships with the voices they hear. And this study is interesting because these are all targets that evidence-based transdiagnostic and cognitive remediation psychological interventions can focus on. And I use that word transdiagnostic just to mean that many of the processes, so the things that we think might maintain people's distress and sense of being stuck in psychosis, are similar outside of the diagnosis of psychosis too. So we're talking about processes such as feeling the need to avoid or to engage in behaviors to seek safety, or to worry over things excessively, you know, or to jump to conclusions, you know, so those types of processes, and we'll talk a bit more about that as I present today. So all of these sort of targets, if we use that word for it, these are things that when I look at the list, they're things that lots of people want. You know, a sense of being engaged in the world and feeling a range of feelings, but feeling a sense of control, a sense of confidence about what you're doing. And the important thing is, I think, is that we can see the commonality between the recovery goals of people with psychosis and all sorts of other people. And that many of these areas are areas that psychological therapies can help with. The other consideration is about personal recovery. So increasingly, consumers with psychosis and their loved ones, and you know, through the work of the Mental Health Foundation and other non-government organizations, increasingly people are having a voice about what they want in terms of their treatment and care, what they want to aspire to. And an important consideration is about personal recovery, that our approaches to assisting and helping people should be about helping someone to develop or strengthen their sense of identity, their own personal meaning, and to be able to be engaged in the world in a way that matters to them. And so acceptance commitment therapy that I'll present today, we argue, is a recovery-orientated therapy and is consistent with recovery principles, and particularly the CHIME principles of connectedness, hope and optimism, strengthening identity, finding meaning, and being empowered. And as a researcher looking at psychological therapies for psychosis, this is an important dimension of the work, is that chasing outcomes such as the reduction of symptoms is not as important as fostering a sense of autonomy and control, meaning and purpose for people. And this is what we should sort of judge the care and treatment that we're offering by. So I'll briefly describe what acceptance commitment therapy is. And this is a particular focus of of today's talk is to just give you a sense of this approach for people with psychosis. Now, acceptance commitment therapy is a larger model that is transdiagnostic. So in other words, underpinning this is a model of human effectiveness and well-being that cuts across disorders and problems and identifies a set of skills that can help all of us to be able to be effective, engage with meaning, do the things that matter to us. So acceptance commitment therapy is called ACT for short, and it's a form of cognitive behavioral therapy, and it is a mindfulness-based intervention. And thus far, the evidence suggests that ACT and mindfulness appear effective in helping people with psychosis with their overall symptoms, with depressive symptoms, with rehospitalizations, and in terms of improving functioning. And so the work I'll present today is around that. We have an intervention that we've been developing that's about personal recovery and functioning and improving people's well-being. It's an empirically based therapy, so there's still a lot of that we don't know about how effective it is and what the particular processes of change are. But we have a sense that if we can help people to be able to be more here in the present moment, to identify the things that matter to them, and to take actions toward those things, to activate themselves and to learn from experience, that this tends to lead to improve outcomes for people with psychosis. There's some particular areas of research that are going to inform this approach even more. So the last 15 years have seen mindfulness-based interventions be developed and researched for people with psychosis. And we're really at the point of needing to understand better when and where and how we may use mindfulness in safe and effective ways for people with psychosis. So there's good evidence that certain forms of mindfulness, so some sort of present moment awareness practice and some form of active acceptance towards experiences does help people with psychosis. But we want to seek to understand more which practices in particular and the best ways to be able to engage people in mindfulness. We also want to develop further the idea of process-based interventions. So where cognitive behavioral interventions for people with psychosis have gone is from sort of large models that sort of had a one-size-fits-all perspective to particular models about symptoms and problems and challenges, and understanding those symptoms and problems and challenges in a more specific way. So an example of this would be the work that Daniel Freeman and colleagues have done in the United Kingdom around persecutory thinking, where they have been able to show that focusing on the processes that may increase the impact and distress and preoccupation that people have with persecutory ideas. So processes such as worrying or avoiding or having chronic poor sleep, that actually briefer interventions focusing on those processes in particular can have a really big impact on people's well-being. And this is where the field is going, is perhaps about particular smaller but targeted interventions that focus on, for example, helping someone to have a degree of safety at night when they're sleeping, to feel more refreshed when they wake up in the morning, to live more in sync with the kind of life that matters to them. That these things may have a big impact on people's health and well-being. And finally, a strand of research that we've been engaged in is around supporting personal recovery, and whether there are advantages in doing this in a group-based intervention. So people learn from each other, and to support some of the processes of change that we hope can occur when we're offering an intervention like that. So we and others have sought to adapt the ACT model in general to be more useful for people with psychosis. And a focus in ACT for Psychosis is about encouraging more flexible, so more accepting and mindful responding to symptoms and other experiences related to psychosis, in order to increase values-based behavior. And I'll unpack a little bit about what this means today. But the idea of being engaged in your life in a more full way, doing the things that matter to you and learning from those experiences is an important part of offering this type of psychological intervention. And what we're seeking to do is to increase a capacity that all of us have, called psychological flexibility. And this is the ability to be able to be in contact with the present moment fully as a conscious human being, and to do things that are in the service of chosen values, in the service of chosen life directions. And this capacity can be present or not present from moment to moment, from situation to situation. We all can be more or less flexible across situations. But what we know is that people who respond to many situations in a rigid, inflexible way, perhaps because of the circumstances they've grown up with or the experiences they're dealing with, that people can end up being quite stuck because of that way of responding, and finding alternative ways of responding, so coping in different ways, making the moment be about something that matters to you, etc. That this can start to give us, in essence, some psychological wriggle room, some more flexibility around experiences that we find challenging. So this is sort of the underlying process goal in ACT, is to increase a person's capacity to be able to respond with psychological flexibility. The way we talk about this model with consumers and with each other when we're running groups is to talk about 3 sets of skills that improve well-being and our sense of vitality in life. Skill to be aware, to be here and now in such a way that you don't need to run away from here and now. You don't need to engage in lots of control over your experiences. And what helps us to be here and now is to be open to our inner experiences. So being able to skillfully relate to the inner world, whether that's strong feelings we have, self-critical thoughts, feelings of shame, bodily sensations, or indeed, if we hear a voice that is challenging or derogatory to us, being open to this as an experience, while also being active. So using our chosen life directions as a way to guide our actions. So for example, the person who might hear derogatory or challenging voices might understandably end up coping by trying to avoid situations that trigger those voices, being quite fearful of those voices, spending time preoccupied and worried about what the voices are saying. And in ACT, we seek to validate that those responses make sense, and yet they may also sometimes lead us to being stuck. And we help to strengthen the person's own sense of, well, what matters to them? What would they like to be doing in their lives? And how might these skills that we're working on in ACT help them to find a different relationship with the voice, for example, where a sense of openness to it, while also being able to be stepped back from the experience of the voice without needing to control or suppress the voice, for example, and to do the things that matter to you, whether that would lead to some important changes. So all the time when we're doing this intervention, we're talking about open, aware, and active skills. And underneath this is evidence from the psychological literature that things like active acceptance, when it comes to hearing voices, when it comes to regulating our emotions, this sort of thing, that active acceptance is on average a helpful response to the challenges of psychosis. So people who respond to their experiences more in an actively accepting way, so being open to the experience, but also deciding for themselves what they're going to do with that experience. So being flexibly aware, tend to be less distressed, tend to be more engaged with their lives, tend to have more maybe equal relationships with hearing voices, for example. And that this sort of active acceptance is a quality that can be cultivated. We can practice this skill of being actively accepting of our inner experiences. And I say active acceptance because this is not a giving up or a surrendering. It's more an approach of being with whatever is there in your life in this particular moment. Excuse me, and finding ways of still focusing on what matters to you in any given situation. So the other piece of the puzzle in this therapy is called values. What we do in this therapy is we help people to identify what matters to them, what they would choose as life directions. If you imagine like a compass point where I might decide to head east, and I can be guided by a compass about heading east. Our chosen life directions can be like that. So I can be about something larger than this moment. I could be about, say, like today, in sharing with you, I might be about sharing knowledge. I want to make that connection with you today around that. And that might be part of a larger value of connecting with others, of learning, etc., for which this particular talk today is one of the places I'm going in my chosen life direction. So what we're trying to do is strengthen people's capacity to be in contact with their own defined sources of meaning. And hopefully you can see the link there with personal recovery. We're asking people to judge whether what I'm doing, say with a challenging voice, or if I'm feeling suspicious or paranoid, do my actions take me in the directions that I want to go? And many times in life we can find that our actions don't, and that can be disappointing to us. And that might be a prompt to try different ways of coping or different ways of being with these challenges or problems. So we are gently and compassionately inviting people to be curious about their experiences, but also from a position of, would this, let's see if this curiosity and openness to experience helps you to actually do more of the things that matter to you. And finally, in this therapy, we are interested in developing an observing relationship with the experiences. So hopefully you can see that the challenges of psychosis sometimes can be feeling overwhelmed by experience, being caught up with experience, and not necessarily an observing experience like we would just looking at clouds in the sky if we were, sitting on a hillside, not doing anything else, but just watching the clouds in the sky. This type of observing relationship we might develop even with our own internal and other experiences that we have. And this is strengthened by active acceptance. And so a way of slowing down and being present and cultivating a sense of psychological safety in yourself, even if you continue to have the experiences of psychosis, or you're in challenging circumstances. And so all the time in this type of therapy, we're interested in whether the ways that we respond are actually working to give us a rich, full, and meaningful life. And if they are, then keep doing those things. But if they're not, then is there the opportunity here to try something different, to try out some other way of being with these experiences, and to see, again, whether this takes you where you want to go. And so we're exploring with consumers about the ways that they may cope that work in the short term, to try and get rid of unpleasant thoughts or feelings, or to avoid things that are uncomfortable, but actually lead to challenges in the long term, and to learn from their own experience about that. And so the style that we take in doing this therapy is to, well, like today, hopefully I've been modeling a gentle, predictable, conversational style around this. When we engage people in present moment awareness exercises and mindfulness exercises, we do this in a fairly talky way. So in other words, we give a lot of instructions. We don't necessarily have long pauses like other mindfulness or meditative type exercises, because many people with psychosis can get lost in their experiences, or find that feels like an unsafe situation. So we invite people to keep their eyes open, to engage with us in the exercise, and to see what their own experience of this is, and providing our voice and our presence as an anchor while they're doing things like that. We tend to use a central metaphor, a central story, as a way of understanding what's happening to us. We give examples of others who have had these challenges, and how they might try active acceptance and values. And in this therapy, we use a degree of self-disclosure. So we will also share, where appropriate, our own challenges with being human beings and doing things that are meaningful in the world. And in our groups, every session we share about something we're going to do during the week that's based on our values. And we ask the participants in the group to do that, but the leaders of the group, the facilitators, also do that. So I will share with the participants in the group about the things that I'm going to do this week that are related to my values. And then in the next session, I'm going to report back about what I've discovered in trying to do those things. And in this therapy, there's a lot of appreciation of the whole person, the person who has unusual experiences or is recovering from psychosis, and appreciating that they're doing the best they can, that there are likely to be things that matter to them in life, that the ways that they've coped and responded make sense once we understand people's histories, particularly histories of adversity and trauma. We seek to create connection around the shared experience of being human. While I have never heard voices, I can connect and understand about what it's like to feel afraid or ashamed, or to feel threatened by others. We seek to have additions, so the idea of these skills of acceptance and willingness and valuing as additions to your toolbox, as additions to the way that you might cope with your experiences. And the idea of construction, like instead of waiting for one day, if your symptoms do reduce, then you start living, that actually we start living in a way that matters to us today, that we build the things that matter to us today, and to take action in those directions. So hopefully you can see lots of the recovery-orientated ideas in this approach. I mentioned a central metaphor, and here's the one that we use in our groups. It's called the passengers in the bus metaphor. It's a very well-known ACT metaphor, and it basically goes like this. I say to people, well, I wonder if this story fits your experience. It might be that you're like the driver of a bus, your bus of life. And while you've been driving your bus of life, over the course of your life, various passengers have got on the bus. So feelings, memories, sensations, urges, perhaps also experiences like hearing voices or feeling suspicious, and memories and experiences of being diagnosed with psychosis, of the treatment you've had, this sort of thing. And these passengers are on your bus, and at times they make lots of noise. At times they try and advise you about which ways you should steer the bus. And at times you might feel like you have to do what they say, or, sometimes they're threatening. Sometimes you're worried about what would happen if you didn't go the ways that they tell you to go. So sometimes, in essence, your bus is sort of hijacked as you're steering in such a way to keep these passengers quiet and happy, but maybe not doing the things that matter to you. Another way sometimes we cope with our passengers on the bus is we end up maybe stopping the bus and trying to kick these passengers off the bus, or argue or fight with them, get caught up with them in some way. But what can happen is that our bus of life isn't going anywhere, or we end up stuck. And what we're going to explore in this therapy we're going to do, or in this group we're going to do, is another way of being with our passengers, which is maybe a way we don't use all that often, which is to be willing to have the passengers on the bus. They've got on the bus, and there they are, and sometimes they're noisy and sometimes they're not. Sometimes you can see them, sometimes you can't. And they're going to be passengers, and there's going to be times when they make lots of noise. And your role might be, if you wish, to welcome them on the bus, to see that they have a place on the bus, but also to keep your hands on the steering wheel and decide to turn your bus in the ways that matter to you. And sometimes the passengers will make lots of comments and noise about it, and sometimes they won't. And yet you may also be going in the directions that matter to you in life. So that metaphor is a metaphor about values. It's about acceptance. It's about an observing relationship with experiences. And we use that metaphor throughout our groups. So these days we call our groups Recovery Act, and we have a version of these groups that we are evaluating in a research study in Melbourne. We developed a manual around this that's freely available in those links at the bottom of this page. And this group is both for people recovering from psychosis and for caregivers. So these are not two people together. We have groups for people with psychosis or their family members or loved ones. But basically we have the same group program. And the studies we've done have looked at a 6-session version of this group. And in each session, there's some sort of noticing or mindfulness activity, some sort of activities around valuing. So in other words, identifying what matters to you, and identifying behaviors this week that you could do that matter to you. The central metaphor of the passengers on the bus, and some sort of planning of actions you're going to take this week in line with your values. And so we use this central metaphor of the passengers of the bus. We tell the story of the passengers of the bus. We link the story to an example of someone else's life. We use the language in the group. So what passengers have you noticed today? Where is your bus of life going today? And we also act out this metaphor. So we have people volunteer to be the bus driver, and we play, the other group members play the roles of their passengers, and we try out these different ways of responding to self-critical thoughts or anxious feelings or derogatory voices or paranoid ideas, whatever it is that the person wants to bring. We have done a couple of studies in this. So we've done 2 trials, randomized controlled trials around this, and looked at and done service effectiveness studies in multiple countries. So studies in the United Kingdom and Australia, but also service effectiveness studies in Italy and New Zealand and elsewhere. And there are indications that this type of intervention does improve people's well-being and sense of personal recovery. So the study that we recently did in the United Kingdom was of this 6-session version of the group. It also involved peer group facilitators, so experts by experience who are co-facilitators with us in guiding people through the mindfulness and values-based exercises. And we conducted these sessions in community settings. And we've designed the groups such that if you have trouble attending in any particular week, you won't get lost. If you come back the next week, it's basically the same format. We go through the same format each time. It's just different exercises and different content that we focus on. But clearly, the group is about noticing your passengers, choosing your directions, engaging in things that matter to you, and learning some skills to be able to be with the experiences that arise as you do the things that matter to you. We think there's lots of advantages to doing psychological therapy in groups for people with psychosis, particularly when we're doing a therapy like ACT. Many of the ACT metaphors are interactive and actually benefit from having more people engage with them, particularly, for example, the passengers in the bus metaphor, when people are acting this out with each other. It's also often easier for us to notice how others get entangled by their experiences. We call that getting fused in ACT, so just getting caught up. It's often easier to notice that in others first before we start to notice that same process in ourselves. And observing others, being present and willing, can promote these processes in ourselves and be a powerful experience. And many times in these group sessions, we have been, so touched by how deeply people are engaging and learning the skills and approaching the things in life that really matter to them. And being inspired by other people in a group setting could really help foster a sense of personal recovery. It also, I think, is that if you make commitments in a group context, so in other words, if I say this week that I'm going to engage in this particular activity as part of a valued action, there's more chance that I might actually do that, because I want to be able to report back to the group members next week that I've done this, and their interest and engagement in my life and what I'm doing might help to motivate me to persist with doing things that might be challenging to do. And of course, the other advantages about being in a group are around common humanity and around connection, a sense of reducing your own personal stigma and increasing your self-compassion, discovering you're not the only one. And this is an important piece, I think, for people with psychosis who are seen in public mental health settings. Many of the people that we see in those settings are socially isolated and experience exclusion from their community. And to be able to come to somewhere where everybody understands what it's like to be you, to be included, for there to be an openness to you don't have to be particularly sociable today. Just you being here in the group is enough. That's terrific. Having a place where you're welcome is really powerful. And having a place where you feel like people understand what it's like to be you, because perhaps they have similar experiences as you, is really important. And this is what our studies have found. This common humanity piece is really, really valuable to people. As I said, we use other people's stories to illustrate what we're doing in the group. So typically in our groups, we show a video or we tell a story about another person who struggled with things. So here's a still from one of our videos. This is Paul, who's telling the story of recovering from a paranoid episode. And he tells a story for about 5 minutes or so. And then we ask our group members to identify what passengers are on Paul's bus, so what experiences might Paul struggle with or be bossed around by, and the ways that Paul responds to his passengers, and what we think might be important to Paul, what values may matter to him. And so we use someone else's story first before we turn toward your own story and how you might understand yourself according to this metaphor. And pretty early in our groups, we act out the metaphor of the passengers in the bus. So these are some workers at some training I did a few years ago who are practicing running this exercise. You can see that the person in the middle there is turning back and responding to a voice that one of the other group members is being. So saying, tricky or negative things to her. In front of her is her valued direction. So the person with the piece of paper has actually got written on the piece of paper something that matters to the participant. And we're guiding people through this physical metaphor of the passengers in the bus. And so the idea of the group is to be this creative space where all together we are practicing ways of being more open, aware, and active in our lives. As I described, there's lots of different ways of practicing being present and open. So we typically start with not with eyes closed, focus on your breathing exercises, but more focusing on things like a piece of fruit and the experience of a piece of fruit. A classic way of learning mindfulness many times can be around a raisin or something small like that, but we find that people can lose that or drop that, while something like an orange or mandarin is more solid and they can focus on that. We work from the outside in, basically, to start with objects and then with your breathing, the sense of your body, but not just your body being still, but with movement. So we use walking and stretching type mindfulness exercises, and then also using imagery like the clouds in the sky, or watching your thoughts and feelings like leaves on the stream. In general, we keep our mindfulness exercises simple, but we use all sorts of different ways of being mindful, and we're really clear that there isn't one right way of being mindful and being present, and that we're reinforcing all sorts of noticing of our experiences. The other important part of our group is about values. We're asking people basically what they want their lives to be about, and that can be a challenging question, for all of us to answer. And so we use ways to explore a little further what matters to you. We'll use values cards. We'll use the examples of others. We'll ask people who their heroes are, who are people that they admire. What qualities might these people have that you would like to be able to show in your life? And then we get down to, how might you actually do that this week? Choose one of these areas, whether it's about meaningful activity or relationships, or how you have fun or do things in your leisure time, or what you do for your personal growth, or any other area of your life. And then think about a few simple actions that you might take that are in line with your personal values. And we do that from week to week. So you can see that over the course of sessions, the people have, we're basically doing this activity every time we meet. We're building up the sense of doing things that matter. And that, at least in our group, we've got a community of people who are interested, super interested in you doing what matters and seeing what you discover by doing that. And that's the other piece, is what did you notice when you did those things? What was that like for you? What passengers on your bus showed up? Where was your bus of life going? And so here in Melbourne, we've taken the work that we developed in the United Kingdom and we've adapted the group manual a little further. So we're running a large-scale project across multiple health services in Melbourne, Peninsula Health, Alfred Health, St Vincent's and Northwestern Mental Health. And we now run an 8-session group. We've actually reduced the session length to about 90 minutes. And we're running this as an evaluation across sites. We typically get 8 to 12 people coming regularly to the group. The group is closed. So in other words, once you join, we have the same set of people through for the 8 sessions. But the group's also flexible. So if there's weeks that you can't come or you want to leave early or whatever, then that can happen, because basically you'll know what the group involves because we've provided a sense of the structure of it, and you'll see what we're like with running the group. When we followed up people about our groups, we get this sort of feedback, and this diagram here is from a thematic analysis that Lauren Kirkwood at Trobe University did, where she followed up people who'd been in the Recovery Act groups. And what people describe is how Recovery Act was valued by them, the contrast with this type of group setting with some of their other experiences in treatment, particularly some of the more coercive or challenging aspects of their past treatment for psychosis. And that the group involves, yes, a sense of interpersonal vulnerability. So you come to a group setting, you're taking some interpersonal risks and sharing some things you're vulnerable about, but that those risks also lead to improvements that they're worth taking. A sense of living beyond the illness. So nothing in our groups is about accepting that you have been diagnosed with schizophrenia. It's all about what matters to you in life. What do you want to be doing that could be in line with that? So it's all about a sense of personal recovery and living beyond the illness and stepping into your experiences to rebuild a meaningful life for yourself. And in that is also personal growth. So people report a sense of improved well-being and a strengthening of what matters to them, of them engaging more in the roles that they have in their lives that are meaningful and important. So this is a sense of acceptance and commitment therapy for psychosis, at least the way we're doing it here in Melbourne. In here is also the idea of holding your values lightly, so your chosen life directions lightly, but fully engaging with life if you can, pursuing them vigorously. And this is a quote from one of the originators of acceptance commitment therapy, Kelly Wilson. Hold your values lightly, but pursue them vigorously. You can always change directions, but engaging with life fully, even if you have scary, frightening experiences, even if you have a sense of being caught up at times with those things, matters. And if I give you a sense that what acceptance and commitment therapy involves in terms of these open, aware, and active skills, that you could do this even today. You could do this following this talk. First you could become, aware of here and now. You could connect with here and now in some way. You could be in your body with whatever is going on in your body and notice your experiences of curiosity. You could practice making room for your experiences as they are. So I notice I'm having these feelings and thoughts and urges. Just for a little while, not needing to do anything else with this, but just to observe and notice. Or in ACT, we would say make room for these experiences. And sure, that's something that all of us needs to practice at getting better at as time goes. And then today, now, you could connect with what matters here and now. This last 45 minutes, what's mattered to me is to connect with you and to share about this. And the experiences I've had in my body as I've been doing this have been part of that. My nerves, my dry mouth, the sense that I'm just talking, like the thoughts about that. And yet also I've spent 45 minutes engaging in a varied direction to me about learning and about connecting. So this moment has been about that. So how could you make your next moments be about what matters to you? And just how might you hold yourself and move your body in ways that reflect that, you know? And these three pieces are what acceptance commitment therapy is about. And yes, it's a model of well-being and flourishing across all sorts of different environments, but also for people with psychosis and in supporting their personal recovery. So with that, that's the end of my presentation. I hope that's been interesting to you. I'm really appreciative of the opportunity to share this with you today.